and Health Officer of the CHP, and Dr. Lau Ka-hin, Chief Manager of the Hospital Authority. The doctors will tell us the latest situation of the COVID cases and also the HA. Dr. Lau, please. Media friends and members of the public, good afternoon. Sorry for the late start today. Now I'm going to report to you the cases reported on the 29th of June. That was yesterday. Yesterday, for locally infected cases, there were 2,196 cases, including 823 positive cases confirmed via PCR and 1,373 cases confirmed via RAT and then confirmed by PCR tests. And also there were 162 imported cases, including 123 confirmed via PCR and 36 confirmed via RAT. The total number in the fifth wave is 1,233,166 positive cases. There were 2 new deaths yesterday. So far, the death toll in the fifth wave in Hong Kong is 9,188 cases. Dr. Lau, please tell us about the hospital authorities situation. Good afternoon. There are 692 patients receiving in-hospital treatments. 115 are new patients. For those who need to be hospitalized in isolation wards, 331 are in our first tier 1 ward, 20 in our second tier ward, and 221 patients are in the North Lantau Infection Control Center. Altogether, 90 are new patients. Yesterday, additional patients was reported to be in critical condition and 1 patient in serious condition. At present, among the inpatients, there are 12 critical and 13 serious patients, among which 3 critical patients are in ICU for treatment. And there are also new reports of 2 patients who passed away yesterday. They were both female, aged 85 and 98 years, and they were both residential care home residents. In terms of vaccination record, 1 deceased patient had 2 doses and 1 was not vaccinated. So for the 85-year-old deceased female, she had chronic illnesses and was residing or rather she was not mobile and she could not communicate and relied on long-term care, and she also had dementia. On the 29th of May, she was tested positive on RAT, and on the 12th of June, the results already turned negative, and she did not check into hospital. For the recent hospitalization, it was because her deteriorating health. At ANED, it was found that her face was asymmetric, and it was diagnosed to be an acute stroke. For the 98-year-old female deceased patient, she was also a chronic patient. She had a colon cancer record. The recent hospitalization was because of coughing. Upon hospitalization, it was found that she was a positive patient. Her situation deteriorated, and she passed away yesterday. So, Dr. Lau, please. Dr. Au. Thank you, Dr. Lau. I will continue reporting cases yesterday. Among the 162 imported cases, 74 were identified as the temporary specimen collection center at the airport. 70 were confirmed during hotel quarantine, and the remaining 18 were identified to be positive after quarantine. For residential care homes, we have 7 reports from care homes, including 2 care homes for elderly people and 5 care homes for people with disability. For the elderly care home, there were 2 staff and 2 residents. For the PWD care home, there were 5 staff and 2 residents. The first one is the Wang Dai Xin Qihua elderly home for the elderly, care home for the elderly people. The resident was tested positive in hospital, and he went out on the 23rd of June, and 4 residents are classified as close contacts. The second one is the St. Joseph elderly care home. 2 care staff have tested positive. The onset was 28th, and also the staff members last work on the 28th. Some 20 residents have been classified as close contacts. For a PWD care home, that is the Yilok training center for adults in the South District. The carer was tested positive on the 20th and 27th, and he last worked on the 20th, and 7 staff members are also classified as close contacts. The second one is the Eastern Yunnan Association Chaiwan Home. A care staff who has been vaccinated with 3 doses was tested positive, and he last worked on the 28th. 7 staff and 5 residents are classified as close contacts. The third one is the South District Tonghua Group Hospital, Jockey Club, Jinyin Day Activity Center, and Kam Hostel. A care staff has been tested positive. His family members were also tested positive on the 27th, and he last worked on the 27th as well. There are 12 residents classified as close contacts. The fourth one is the Shatin and Yiyan Sanzhong. 1 assistant is tested positive with 3 doses of vaccination. He has no symptoms, and the 28th RAT test returned positive, and 1 resident is a close contact. The last one is the Kowloon City Yunnan Association Seng Hongyuan. 1 care staff is tested positive. The onset was the 29th, and he was tested positive on the same date. For the floor which he is responsible for, 1 resident also tested positive on the 29th via PCR with no symptoms. 6 residents in the same room are classified as close contacts. In terms of previous residential care homes with outbreaks, yesterday we mentioned the New Life Psychiatric Rehabilitation Association Pok Hong Halfway House in Sha Tin. There is 1 new case today who is a resident. He is a close contact of the case reported yesterday. On the same floor, there are 3 residents tested positive. The remaining 30 residents on the same floor are classified as close contacts and require quarantine. The 3 patients are all workers as the at the New Life Nam Chong shelter workshop, but they are working as different floors. To be safe, we have issued a compulsory testing notice as the shelter workshop, and all workers there are required PCR tests. So far, no new case has been found, and a thorough disinfection has been carried out. This morning, we have 192 cases from school involving 148 schools, including 31 KG and CCC, 60 primary schools, 60 secondary schools, and 3 special schools. In the past 7 days, for schools with 2 or more cases, there are 133. 1 school has seen outbreak in a class, that is the Salvation College in Fanling. For a class in secondary 3, we have found 3 cases, and the class has been suspended. Yesterday, we have found 8 BA.2.12.1 cases, including cases with epidemiological links, with 6 untraceable and 2 being family members of the 6 cases. They live in Sanying Chun Kinghua House, and the other one lives in Tien Yat Estate Yatham House in Tin Shui Wai. The 3rd patient lives in Block 8 of On Tai Estate in Kwun Tong with 2 cases. The 4th patient lives in a Wai House in Tin Hua Estate in Tin Shui Wai. The other patient lives in Wo Che Estate, and the other one lives at Yi Ging Kok with 2 cases. Yesterday, we have also discovered 28 suspected BA.4 or .5 cases, including 15 imported cases and 9 untraceable at present. And other patients with epidemiological link with the other patients.
Of these 9 cases with unidentified source, they live in Tuen Mun Phu Thai Estate Oi Thai House. Second one, Shuning Road, 439 Shuning Road, Shuning House, Shuning Building. The third one, Nathan Road, Hong Kiew Building. In the same unit in this building, there was a second case. Another one lives in Cheung Chau Chung Heng Street, 22B. Another one lives in Tin Shui Wai, Tin Chak Estate, Chak Phai House. And one lives in Shiu Sai Wan Estate, Shen Mun House. And one lives in Discovery Bay, To Shan Court. And one lives in Tin Hau Temple Road, 188, Pak Ho Shan, Block 5. And the one lives in Ching Tai Estate, Chun Tai Court. And 3 cases are related to one of the cases yesterday, that is at Shuning Building, Shuning Road, epidemiologically connected. These 3 cases were related to the case 24th of June at night, Man Thai Wai Sik Forward in Kwun Tong. They had eaten there together. The restaurant insisted for mandatory testing. After a meal on 24th of June, they became symptomatic on 27th and 28th. We didn't find any other cases. We tried to find other cases by mandatory testing. Just now, I misspoke about the 2 patients who passed away. They don't live in residential homes. They live with family members. Past day, 89 patients recovered. 75 were discharged. Second wave, so far 59,700 odd patients recovered. 51,381 discharged. Since early 2020, 64,384 patients recovered, 63,694 already discharged. 2 patients were found to be positive on admission screening. 2 patients in the same ward were listed as close contacts. On staff, 24,348 confirmed cases. Most of them have gone back to work. And now question time. Please tell us about the agency that you work for first. This lady. TBB. Now there were 28 cases suspected BA4 or 5. Now, how many had been infected with BA2? Now, is it expected that more and more will be infected by BA4 or BA5? So even if they were infected in the 5th wave, they can be reinfected. Also, in connection with BA4, some say BA.4, 0.5, they are more infectious. Given Singapore's experience, in the next few weeks, the number in Hong Kong will rise very quickly. Will it be the beginning of the 6th wave? How will we assess that? Thank you for your question. The first question concerning BA.4/5, in the recent days, we found that there were more cases of unidentified sources of BA4 or BA5. It's believed that in the community, there is beginning to be this new COVID variant in transmission. We now hope to find these cases and send the patients to isolation facilities and also their family members. Now, from these cases, we don't find a second transmission. They are new infections. They had no record of being infected in the 5th wave, but we are monitoring closely. Scientific evidence currently shows BA4 or BA5. This Omicron new variant, they are higher in transmission than BA1 or BA2 Omicron. but there's no scientific evidence to indicate that they lead to more serious illness or higher chance of death. And on the other hand, there's preliminary evidence showing that BA4 or 5 might lead. So people who were infected with BA1 or BA2, the antibodies generated may not be able to resist BA4 or BA5. But scientific evidence also shows that after vaccination, it would be effective against BA4 or BA5. Right now, public health laboratory, for each positive case, they will do preliminary genetic analysis, and it's detected that this new variant, Omicron variant. Now, we will also do 452 tests. If we find out, then it shows it may be BA4 or BA5. Now, these cases, out of our positive cases daily, are still a small proportion, less than 1%, but we're still monitoring closely this BA4 or BA5, whether the proportion would increase. Next question. The gentleman there. Cable TV. Why are you late today? Is it that the leader came here and there was traffic jam? Now, some scholars projected that in quarantine hotels, for every one travelers in quarantine, there would be one transmission. Now, whether it's in quarantine in hotels, BA4 or BA5, there has been transmission into the community. Now, even if you discard the quarantine arrangement, there wouldn't be much effect on the community. Now, for BA5, there are more and more cases of unidentified source, and there's transmission in community. Now, is there a chance of community outbreak? Now, 5 years ago, the patient due to an internal organ failure yesterday passed away. So for this child's father, they taking the hospital authority to court. Is there any staff who would be taken to be taken into account, Now, sorry for being late today. Now, on quarantine hotels, in the past, there were cases of transmission within quarantine hotels, but those were very rare incidents. If we find that there was those who completed quarantine and they went into the community and the CT value might be low, we would see whether there is a chance of transmission within the quarantine hotels. So on prevention of import cases, the quarantine hotels play an important role. They can prevent imported new variants being transmitted in the community. Now, apart from quarantine hotels, arriving passengers in Hong Kong, in the first 7 days, every day there would be tests, which is very important. Now, if there is an imported case that tested positive only after arrival in Hong Kong, then we can find out early and isolate them early to prevent outbreak in the community. Now, BA.4 and BA.5 situation, we will monitor carefully, mainly because these variants, they are maybe of higher transmissibility. Now, if they transmit in community, it might be of higher transmission than in the fifth wave. So we are monitoring closely. We are adopting stringent measures. If we find these cases, we try as much as possible to send the patient into isolation facilities to prevent further transmission in community. And we are finding some cases of unidentified source. It might have to do with imported cases or people who work in airport, but we couldn't find any linkage. So, but we think that there might be transmission chain in the community. The outbreak, the chance of outbreak, the risk of outbreak does exist. We will monitor to see whether there will be more of these cases. Concerning the child's passing away, we feel very sorry. We convey our deep regards to the family members. Queen Mary Hospital staff has communicated with the parents to provide all the needed help. Now, all along, close care and communications have been maintained with the family members. Now, the case is in legal proceedings, so we will not respond further on this.
Next question, please. The lady over there. Good afternoon. I'm from Now TV. Now, concerning the Fan Lang Salvation School, there is an outbreak. So, how large is the outbreak? And what about the class with an outbreak? Did the class conduct any activities involving taking off of masks, or was it because of the ventilation systems in the classroom which led to the outbreak? Concerning BA.4 and .5 cases, are they related to the manager who came down with the illness working at the Nina Hotel Causeway Bay? Thank you for your questions. Concerning the school's outbreak, in the past week, we have identified a total of 6 cases. 3 cases were from the same class, that is the 3LY class. The class has 27 students. Since 3 out of the 27 students have been infected, we believe that there is an outbreak in that class in the Khao Yan College. So suspension has been advised for the class. If outbreak is identified as other classes, we will also act accordingly. This morning, all other results returned negative for teachers as well. Concerning BA.4 and .5 cases, we will continue our epidemiological investigation. So we haven't found any epidemiological links between today's cases and previous cases. And so far, no cases are related to the Nina Hotel Causeway Bay case. The next question, the lady over there. Good afternoon, doctors. I'm from Ming Pao Daily. About the BA.4 and .5 infection. Now, Oi Tai House at Fu Tai Estate and Shuning building, we are seeing unidentified or untraceable cases. Do you think there are infections in these 2 buildings? Yesterday, there were 4 untraceable cases concerning this strain. Today, we have 9 cases with some from Changzhou. So how would you assess the level of outbreak concerning the subvariants? Have we identified similarities between the infections with a certain imported case? In total, how many BA.4 or .5 as suspected cases are locally infected? How many genome sequencing have been, how many samples have received a genome sequencing? Now, Dr. Hong Fan Ai said that in winter, we should all keep our mask on and get influenza jab. And these are not needed in summer. So what do you think? Considering the present situation, is it fine for us to not wear a mask in summer? During summer. Thank you. Concerning the BA.4, .5 infected buildings, for the untraceable cases today, no infection is found in other flags in the same building. One building is the Hong Kiew building in Nathan Road. The other person living with the patient in the same unit was also infected. while the other cases are individual cases. We would issue CTN against these buildings to prevent an outbreak in the building. And residents in the building would be subject to a compulsory test. For BA.2.12.1 cases previously, when we issued a CTN, we usually found more cases in the building, so we would keep monitoring the situation. For the Shunning building, we have found 3 cases with links with the patient. They are not living together. They did have meal together and they took off their mask, so they are close contacts. In terms of genome sequencing concerning the cases, we would perform analysis to see whether the gene sequences are similar. For some cases, the analysis is still ongoing. So we haven't found any links between existing BA.4 and .5 cases, and the genome sequences are not similar. So we believe that they are infected in the community. For cases who work at the Sky City in as the airport, we may not be able to find the source of the infection. It may be that the patients who work at the airport have come into contact with infected travelers, and we are not able to get a sample from those travelers. And also, we do have transmission chains in the community, and we are seeing a high level of cases. So people should keep your mask on and maintain all the measures. We are returning to normal, but still we have to get prepared in case there is another outbreak. Is there any other question? Any reporter who hasn't asked a question? The lady over there. Hi, I'm from Hong Kong Economic Times. Concerning BA.4 and .5 subvariants, does the CHP think that we have missed some imported cases? That's why there is a community outbreak. Do you think we have to tighten the measures? Concerning the deceased 85-year-old female, you said she was tested positive on RAT on the 29th of May. So that was a month ago. So was her death related to COVID? In terms of Jade Garden and Victoria Harbour restaurants, do we have no more cases? Do you think the outbreak has ended? Thank you for your questions. First, about BA.4 and .5, all locally found cases with these variants must be related to imported cases, because we did not have such cases. It was only 1 or 2 months ago when these variants began to become common in foreign places. And also we have some family clusters related to imported cases, including 2 cases which were tested positive on the 9th day in the community after the hotel quarantine period. And they returned home and got family members infected. That would be possible, because for some cases, the latent period is longer. So maybe they were left undetected. Still, our immigration measures and quarantine measures are sufficient to guard against imported cases. Most cases are found at the airport or during hotel quarantine period. So it has significantly reduced the risk of the virus entering the community. Of course, nothing is completely foolproof. So we will do our best to minimize the risk. And we have found no new cases from Victoria Harbour Restaurant and Jade Garden. CDNs have been issued. I believe that most patients have, most customers have got tested, and they have been tested negative.
For that 85-year-old lady, now on 29th of May, RAT positive, and then 12th of June, RAT negative. Now, when she was last admitted on the 13th, she felt unwell, that's what she said. Now, this time she was admitted mainly because she had brain hemorrhage. That's the preliminary diagnosis for her stroke, reason for a stroke. Now, first time there was a PCR test. It was negative on admission. Several days later, it's done again. CD value is very high, over 40. At the time, it was confirmed that it's the residual virus from the previous occasion. Now, this time she was admitted mainly because of her stroke. For the real reason, we don't have much information. We estimate that it may not be closely related to COVID. Thank you for attending.